Sir, are you okay?
Oh, yeah, kind of.
Alright, what hurts?
My arm and my leg.
Your arm and your leg hurt? Alright, so
Yeah.
patient's talking to me, he's got an airway. We're just gonna pull off this helmet for you really fast.
Okay.
So that we can make sure that you don't have any damage anywhere else.
Yeah.
Alright?
Yeah.
Alright. Alright, now that we've got his helmet off, Kyle, will you hold his head still so we can manage his C-spine?
Yes.
Alright.
Don't move your head or shake your head.
Okay.
Okay, so we have a patient here that suffered from a motorcycle accident. Some injuries that we notice is that he has an altered mental status due to a possible heat stroke. His body temperature is hot. He has bleeding on a lower extremity that seems to be severe, as well as a deformed deformed forearm. The first thing that I'm going to treat, and this is with stuff that can be found possibly in a passerby in a car, or some resources that I have, is I'm going to treat his bleeding by putting a pressure bandage on it. And what we're using is a pair of shorts that I happen to have in my car as I was driving and noticed the incident. And so I'm going to try and put as much pressure as I can on this by tying this together to try and control the bleeding and see if that helps. If bleeding continues, because I was working an office job, I happen to have a tie, and I found something to create a tourniquet with that I can apply to stop any further bleeding if it's severe enough, just by tying a knot, and then and this is all above the injury, and then tightening the tourniquet with a stick in my case, but if you had anything else, such as any tools or anything that's stiff and long, you can create a tourniquet to stop the bleeding.
Alright, so next we're going to treat the patient's deformed forearm. We're going to immobilize the wrist by using a newspaper that we had in the car and the gym t-shirt. We're going to roll the newspaper nice and tight. We're going to use it to stabilize the wrist. So first I'm going to make sure he has a pulse. And he's got CMS here. Can you feel that, sir? Okay, so still not a whole lot of consciousness going on, but we're going to stick that there. Going to pull the shirt under his arm. Alright. I'm going to use the shirt to keep the newspaper in place. Try to immobilize the arm best we can. Then after applying the splint, I'm just going to make sure I can feel a pulse still, and I can. So we're just going to try to keep as little movement as we can on that arm and try to keep it stabilized.
Alright, so now we're going to treat the patient's altered mental status that he's suffering due to heat exhaustion out in the summer sun. As well as possibly assist him with the hydration. So in our lunch pack we had water, or cool water. We also had an ice pack to keep it cool. So what we would do with the ice pack is we would apply it somewhere where there's a lot of arterial blood flow. And the best places to do that are in the groin, in the armpit, and then the neck, where the coolness can transfer to the femoral artery, the axillary artery, and the carotid artery. which would then help lower his body temperature. You could also do the same thing with water if you didn't have an ice pack, if it was cool enough. We'd also help assist him by giving him water. And then in worst case scenario, if you didn't have those resources, you could try to find a rock or something that is cool, maybe found in a riverbed or something like that if you're around something that you could apply to those same places to help treat for heat exhaustion.